Well, probably started around 1984, 1985, when Alan Fraser and I became president and secretary of the Auckland branch of the Whole-Time Senior Medical Officers Association. Salaries and conditions were pretty poor at that time. By today's standards, they were terrible. We didn't know then they were so terrible, but we knew they weren't very good. We'd been under the previous negotiating system, if you'd call it a negotiating system, was very slow, ponderous, not very effective at getting changes made. Plus there'd been the Muldoon government had been in for 9 years, and they'd interfered a great deal in the economy. There was a wage price freeze on, and there weren't no progress was being made on salaried doctors, salaries and conditions. There was a body called the Health Medical Officers Advisory Committee. This was not an industrial relations system. It was we were part of the state sector. So this was a committee which comprised the Central Specialist Committee of the New Zealand Medical Association, and that represented the doctors who wanted increased salaries and other changes. And the other side of the committee was the employers' side. There was people from various official bodies, the hospital boards, the Health Services Personnel Commission, who wanted to keep salaries down. And this committee had discussions, and every 3 years they agreed on something and gave a recommendation. For salaries, they gave a recommendation to the Higher Salaries Commission, and for who made their own decision based on relativities and whatever they based it on. And for other terms of conditions about working hours and so on, they made a recommendation to the Minister of Health, who would decide whether or not to take the recommendation, and he would then issue determination. The doctor's determination was called M10. It was very widespread. It was the junior doctors, the house surgeons and registrars, who became dissatisfied first. They were represented on the New Zealand Medical Association Central Specialist Committee. So they had their voice, they had that input into that committee. That committee then had its input into HOMAC, and HOMAC had its input into the Higher Salaries Commission and the Minister of Health. So by their perception, and I'm sure they're right, I agree with it, by the time their voice actually got to where the decisions were made, it was a long way, took a long time, and what they wanted was watered down. So they broke off, in effect. They formed a separate union. At that time, in effect, the New Zealand Medical Association was the centre of power for issues involving salaried doctors, whether they're whole-time, part-time or RMOs. And this was done through the Central Specialist Committee of the New Zealand Medical Association. When the legislation changed so that we had to form a union, the New Zealand Medical Association were allowed to be the union provisionally for a year, and the Central Specialist Committee was regarded as the national executive of the union. But it was made clear that the NZMA could not continue to be a union because it represented employers as well as employees, and that was something that wasn't permitted under the Industrial Relations Act. So that was the impetus, which meant we had to form a union separate from the NZMA. And I have to say the NZMA was supportive, perhaps reluctantly, in achieving this. Well, I was a young intensive care specialist near the beginning of my career. I had 2 years in Christchurch, and then I got appointed to Auckland in 1980. So I was in the early days on a pretty miserable salary, working 1 and 2, 1 and 3 roster, nights, weekends, public holidays, and not being paid for it. And my wife was complaining because we had a mortgage, we had a young family, and so on, and she wanted me to go and work part-time in anaesthetic private practice, so we'd earn more money. I didn't want to do that because I loved my job in intensive care. I liked being a whole-time specialist. So I decided that I would have to try and get conditions changed. So that's where I came from, just as an intensivist in Auckland. The Judson sandwich episode happened around that time. I should explain that there was a salary scale, steps 1, 2, 3, 4, up to 8, I think, and then some additional merit steps. Doctors were employed on a 10th system. A 10th was 3.5 to 4 hours. So if you're a whole-timer, you were 10/10ths. You could be in private practice, you could be working 5/10ths for the hospital, 5/10ths in private practice, any number of tenths. Now, a 10th took you up to, 10/10ths would be a 40-hour salary. There was a system where if you worked between 40 and 44 hours, you got an extra 10th, so you got 11/10ths in effect. That was called the additional duties supplement. No, actually, if you worked more than 40 but less than 44, I think you got an extra 4%. If you worked 45 or more, you got an extra 10%, and that was it. So you could work as much as you like, or as much as the job required, on call, nights, public holidays, or whatever. You didn't get paid any more. Well, one night I got called into the intensive care unit. It was the middle of the night, and I was up all night working there. And the nurses took pity on me and ordered me a sandwich from the hospital cafeteria. They used to supply meals at night time back then. So they brought me this sandwich, which was very welcome. And some days later, I got a bill from the hospital administration. I got presented with a bill for it. It would only have been a few dollars, but the principle of it really annoyed me, like it outraged me. So I made a fuss about it. It ended up being on the front page of the New Zealand Herald. And there were other episodes, dissatisfactions with conditions of service that I publicised and made a fuss about. Well, several things had to happen. I mean, it wasn't enough just me being dissatisfied. In general, there was a lot of dissatisfaction in Auckland over the wage price free, the way the salaries were low and weren't being increased, and costs were going up and cost of living was going up, etc. So one of the first things that Alan Fraser and I did was hold a stop work meeting in Auckland, and invited doctors from the different hospitals and the different specialties to come to a meeting to discuss our grievances. And we got that publicised, and it was on TV. leading out of that, we arranged a meeting with, by this time the government had changed, Muldoon was gone, David the Longy Labour government was in, the Minister of Health was Michael Bassett, and we arranged to have a meeting with Michael Bassett on a Saturday morning, and the TV cameras were there and so on. We tried to publicise this. So Alan and I and others in Auckland sort of tried to get public attention to how poor things were for public hospital specialists. As well as that, we revitalised the association we belonged to. The association that represented us was called the Whole-Time Senior Medical Officers Association. There was a separate association called for part-time specialists as well, but we were coming from the Whole-Timers Association. We revitalised that organisation. We made it a proper national organisation, formed a national committee, and tried to get that committee to improve our conditions. How that worked was because the Whole-Timers Association was represented on the Central Specialist Committee of the New Zealand Medical Association. So we tried to get a much stronger voice going into the Central Specialist Committee. And we succeeded, but it took some years to do it. So firstly it was strengthening the Auckland branch, then forming a proper, making it a truly national association, strengthening the input into the Central Specialist Committee. But even that wasn't good enough. As I said, the junior doctors had already split off and formed a separate union of their own. I wanted to do that as well, wanted us to split off and go our own way rather than be locked into the cumbersome system that we had there. That wasn't easy, but we had a stroke of good luck that assisted us, and that is when the Labour government took salaried doctors out of the state sector and put us under the Industrial Relations Act, I think it was called, which meant we had to form a union. Yes, there was a lot of uncertainty, a lot of anxiety, because when you talk about industrial relations, you think of strikes, you think of watersiders, you think of cooks and stewards union. Doctors really didn't want to be involved in that sort of thing. One of the things shifting us out of the state sector into the Industrial Relations, Labour Relations Act, whatever it was called, meant we had the right to strike. Well, we didn't want the right to strike. We argued against it, but we were put there, we had the right to strike. Not that we've used it, but there was a lot of anxiety about that. Probably especially from, well, the more conservative parts of the profession. Well, we've got a good salary scale. These additional merit steps have gone, so there's just a progression that goes up until you get to the top. You can argue how many steps and what's between the steps and so on, but at least there's a salary scale, which is much, much better than it was. We've got a job sizing system, which means that each job can be measured. So if your job means you work 50, 55 hours or whatever, then you get paid for that. We've got a system for recognising on-call, just being on call, having to hold yourself available, not drinking, to be on call, and then if you do get called, a system that remunerates you for the hours that are involved in being on call. Another big thing is, there are lots of things that we've achieved. The continuing medical education allowance. Before that, if you wanted to go to a conference, you had to apply, and I think it went to Wellington and got considered by committee, and someone might decide you could get a bit of funding. But there is a lot of people approaching drug companies for grants to go to conferences. I did that myself in the early days, which is a terrible thing, but that's what you had to do. But now we have as of right an allowance to pay for airfares, accommodation and conference registration and so on. That's a huge breakthrough.